and welcome to HealthAssay. I'm your host, Amazing Tife. Now, in the world of global health issues, few enemies have been as stubborn as malaria in Nigeria. The fight against this disease has been especially challenging. Now, this is a battle that has seen some progress as well as also faced some setbacks, and people have come together to try to overcome it. But there are still, many difficulties to overcome. Now, when we think about this disease, malaria, we realize that it's not just about fighting tiny parasites. Also, it's also the thing of dealing with cultural mindsets, beliefs, and behaviors that are deeply ingrained in the Nigerian society. Now, joining me as we talk about the malaria burden in Nigeria is Mr. Odinaka. Odinaka is a trained and licensed biochemical scientist and a public health enthusiast with experience in health communications, youth development, policy development, and advocacy in global health. He is the executive director of Block Malaria Africa Initiative, a malaria intervention initiative aimed at combating malaria within most at-risk population across the African continent. He serves as the West African lead at the African Leaders Malaria Alliance Youth Advisory Council under the leadership of President Sosco Embalo of Guinea-Bissau. He is also a member of the RBM Digital Youth Workstream on Malaria and a Zero Malaria champion advocating for Malaria-Free Africa. Odinaka was one of the Nigerians representative at the 2022 Commonwealth Youth Forum and the Kigali Malaria Summit in Kigali, Rwanda. He was also an international observer at the 72nd WHO Regional Committee meeting in Lome, Togo.
Hello, Mr. Odinaka. It's nice to finally meet you. Let's introduce you.
It's a pleasure to meet you myself, and then I'm so glad to be doing this with you. My name is Odinaka Kingsley Odinaka. I am a trained and licensed medical laboratory scientist, and I'm also the West African lead for the African Leaders Malaria Alliance Youth Advisory Council. So I also lead Block Malaria Africa Initiative here in Nigeria. And as it is, I'm also a very passionate and committed malaria champion, contributing my quota towards malaria elimination in Africa. So it's quite an exciting moment to be here discussing malaria.
Great, super. Yeah. All right, so let's just go straight into the question. All right, so can you just give me an overview of malaria situation here in Nigeria?
Okay, so that's really impressive. Let me start this way. Malaria is actually one of the most devastating diseases that is plaguing Africa, most especially Nigeria. And it is important to note as well that the African continent has the highest prevalence rate of malaria all over the world. Just a bit of statistics. Look at the 2022 World Malaria Day report, which was released in 2022 November. It gives us a picture of what the malaria situation in the world in 2021 looks like. So in 2021, we have about over 234 million cases of the disease, reported in sub-Saharan Africa, just to let you know how much of a burden the disease is to the African continent. And then Nigeria has the second highest number of the burden with about 21.6 million cases. Now, according to the report, Nigeria contributes about 26.6% to the global malaria burden. What that means is that 1 out of every 4 persons having malaria all over the world, Nigeria is inside that. Now, this is a very serious issue.
Yeah.
With the Nigerian population hitting over 220 million, in estimate, it is important to reveal that about 40% of Nigerians, survive on less than $2 per day. Some years ago, we rated the poverty capital of the world, if you remember.
Yeah.
Now, this poverty rate in the country has led to an increase, on the in the unhygienic living condition that serves as breeding sites for malaria, carrying mosquitoes, as many Nigerians lack access to basic amenities like clean water and safe sanitary facilities, and even poor access to primary health care. You understand? So now, just to look at this even a bit more critically in the Nigerian context, many Nigerians are unable to have access to quality healthcare services, and this is leading to high mobility rate across the country. Nigeria experiences the tropical climates. We have a rainy season
Yeah.
and dry season competition, and as a result of this, there is a very large focus, of malaria infection across the country, right? Now, today, in the recent data from WHO, Nigeria is one of the four African countries that contribute the highest to the global malaria cases, and this is a very serious situation. So, if we look at how much of an impact this disease is to the Nigerian population, we say that over 100 million persons in Nigeria, are actually at risk to malaria. So we're looking at more than half of the Nigerian population. So this is a very serious situation, and this is where we are as a country when it
Okay.
comes to malaria.
Okay. Well, you when you started, you mentioned something. You said malaria is a serious condition in Nigeria. You used the word devastating, and interestingly, many people don't see malaria that way. Many people see malaria like you have malaria, go and buy artesunate or amatem or something, and then so how do we address this situation? People don't see malaria as a big deal anymore. People see it like it's a normal condition, like it's normal for Nigerians to have malaria. So how do we address this?
Yeah, so like I said, it's the situation of malaria in Nigeria is actually a very critical one. If we look at the entire world and we're able to say that Nigeria is recording the highest death rate, as a result of malaria, then that makes malaria a very serious concern in Nigeria. You know, because of the fact that malaria on most occasions does not kill on an instant, a lot of Nigerians have come to take it for granted. And this is not just the major reason. The fact that they are unable to also access quality and affordable treatment for the disease promptly has also become a very serious concern. So
Okay.
that way, people tend to see malaria as one of those diseases that that they can easily just cope with. And again, malaria presents with too many symptoms that are associated with several other illnesses. So someone comes down with headache, and the person still thinks that it's just headache. Meanwhile, he or she, because he or she has not been exposed to proper diagnosis, we're unable to confirm that this case is a case of malaria. And in most cases, malaria itself as a disease is most prevalent. There are two categories of population that are mostly at risk to the disease. So we have children under the age of 5, and we have pregnant women. Now, for these two categories of people, or population, whenever this disease strikes, it is almost on a death case, on a death situation, right? It is 100% life-threatening in both conditions. So people who fall outside this category, a lot of the times have been found to play or joke with the disease.
Okay.
But then the statistics I've mentioned earlier, telling you how Nigeria contributes about 26.6% to the global malaria burden, and then 31.3% to the malaria deaths globally, should let you know that we lose a ton of numbers of people on an annual basis. You understand? From this country. I remember in 2019, the death record was that Nigeria recorded about 89,000 deaths from malaria.
Wow.
Just malaria. Yes, 89,000 deaths. So the statistics you're seeing, that is 31.3 is a higher rate as compared to 89,000 deaths. So that is a serious case for concern. So Nigerians just need to wake up to realize that the disease they feel doesn't kill an African man is really the cause of the major deaths. It's one of the number one African killers, of Africans continent.
Wow.
So we need to really wake up.
Okay, so you spoke, because I'm sorry, I'm digressing from the questions that I have written, because some of the things you're saying are like interesting and things that many people have not thought about. For instance, you mentioned about people not having access to quality healthcare when it comes to treating diseases like malaria. And now I want to ask, like, somebody has malaria and they're not looking for a hospital. They are not looking to get tested. Their mindset is, oh, go to the pharmacy, go to the chemist, go and buy so drug. So how do you quantify or qualify uh, quality healthcare when it comes to treating malaria? What is the right thing for Nigerians to do when it comes to treating malaria?
Exactly. So it is clear that not just malaria, but as it concerns every other illness. When, as an individual, you come down with certain symptoms, right? Some of the symptoms of malaria could be headache, it could be fever, it could be loss of appetite, it could be stomach ache for some people, it could be joint pain for some people. The symptoms are just numerous, right? It could be nausea for some people, it could come with dizziness as well, and diarrhea and a whole lot. Now, when you come down with any of these symptoms, the requirement is that you go to the hospital to see your doctor, right? Your doctor is expected to take your vitals, check you properly, and then make a recommendation for you to get tested. Okay, so
Yeah.
you go to a standard laboratory that is manned by a certified and licensed medical laboratory scientist who takes your blood sample, carry out a blood film or use a rapid diagnostic test kit to check if you have the malaria parasite in you, right? Now, after that, your result is out, and then you go back to the doctor. Your result is supposed to tell the doctor, whether you have malaria in your system or not, and to what percentage. It also tells the parasite density in your system if you have the parasite. Now, from there, the doctor is able to make proper prescription as to the medication, that you should, take, and then for the duration and all that. So that is how it should be. However, because of the lack of access to quality healthcare and because of the lack of awareness, okay, and then there is a very serious issue of poor health education. So people don't have an information on how deadly malaria as a disease is, and then they subject themselves to self-medication. And this in itself is a major contributor to why we are not able to fight malaria effectively in the 21st century, because we're beginning to record a lot of issues around anti-malaria drug resistance owing
Wow.
to self-medication, and then the sales of over-the-counter drugs and a whole lot of other issues. So these are emanating issues coming up because people are not adhering to standard practice.
Let's talk about that anti-malarial drug. No, because I'm also guilty of this. Let me just put it out there. I'm also guilty. I feel symptom of malaria. I'm going to the chemist to get, I'm going to the chemist to get drug and, take my drug, and next day, the next 2 days, I'm all right. But now you're talking about this anti-malaria drug resistance, and it's ringing in my head like, girl, there's fire on the mountain. Let's talk about this thing, because the points you are saying are very, very interesting, and a lot of people should know about this. Yet there's no real awareness about this thing. Like,
Yeah.
I don't. Well, okay. To be honest, I really didn't see the need to go to the hospital and start getting all these procedures to treat malaria. I just feel like malaria, okay, you show the symptoms, you are weak, you go. Do you understand? So let's talk about this resistance to the malaria drug. Let's talk about it. Can you just
Yeah. So the issue of resistance is actually a very serious conversation, and it is currently a global conversation, right? Because I believe you must have come across things like antimicrobial resistance.
Yes.
Today we're talking about anti-malaria drug resistance. Okay, it's a very serious issue. We also have insecticide resistance when it even comes to the issue of malaria. Okay, so let me just pick up from the fact that when we begin to talk about resistance, we are looking at the ability of you as an individual to ingest the medication, and then the ability of your system, or the parasite rather in your system, to resist the effect of that medication. Hence, no matter the quantity you take of that medication, the parasite in you, if it's in you, will fail to comply to the instruction being passed by the medication. So when we're talking about resistance, that is exactly what it just means. You're taking medication, but you're not seeing results, right? Now, we also have an issue of insecticide resistance. I think I should start from there, and then we'll wrap up with anti-malaria drug resistance.
Okay.
Today, you see that a lot of insecticide out there which can be used to repel, mosquitoes and a whole lot of other insects, are not being effective. You spread the insecticide in your room, and then you let people go out, and when you come back, the mosquitoes are still there. This is a very serious issue. You should understand that the mosquitoes over time tend to, get themselves familiar with the content of this insecticide, and then they readjust their system to, to combat the effect of the insecticide. So, according to the WHO currently, the standard, insecticide that can be used, and that will be effective against, mosquitoes must contain certain chemicals, one of which is referred to as, just for short, DEET, right?
Okay.
So the DEET must be contained in your repellent if they're going to be effective. If the DEET is not in that repellent, then you can have what we refer to as icaridine, right? Which is also another component, another chemical that have been noted to be effective right now in combating mosquitoes, which is the vector that conveys malaria, right? Now, malaria itself is caused by the bite of an infected female Anopheles mosquito. Where the problem is that you're not able to identify which mosquito is a male and which one is a female, and which one is Anopheles and which one is Aedes. So the best is to just make sure you repel all. So use insecticides that are effective. So some insecticides that don't contain some of these chemicals are not effective because the vector itself is beginning to get used. Oh, now that is that about insecticide resistance. Anti-malaria drug resistance, like I mentioned earlier, is usually emanated as a result of an abuse of anti-malaria. People feel headache. They are not yet sure if it's malaria, because until it is tested, it is not confirmed, right? Until it is tested, it is not confirmed. I told you earlier that a lot of illnesses present with multiple symptoms associated with malaria. However, it does not mean that you have malaria. Until you are tested, you can't be confirmed. Now, when people go about taking this medication, their body begins to ingest medication that it doesn't need. And just for you to know, all drugs out there are poisons. All drugs are poisons. So when you're taking a medication, that medication ought to function in your system. It needs to have a particular situation it is going in to address. When you don't have any situation, if you're not in a bad condition and you're taking medication, this medication will go there and then gradually begin to have an interaction with the antibodies in your system, and then it begins to prepare itself for resistance. Now, this is the situation we're in right now. So too many people who have resorted to self-medication are the cause of why we begin to have resistant strains of malaria. And these resistant strains, of the Plasmodium parasite, right, is being transferred from one person to the other through the bite of the same Anopheles mosquito. And if this continues, there is now an extended spread of resistant strain of this particular parasite. And that is what results to certain medication being phased out of the market. So if you remember, some anti-malaria drugs you took like 5 years ago are currently not in the market because they are no longer effective. So every year, there's a lot of effort put in to make sure that we develop newer medications, to help address the issue of resistance. Do you understand?
Wow. That's a whole lot to take in. That is a whole lot to take in. Okay, so you've mentioned a lot. You've spoken about the challenges that we already have facing malaria. So let's talk about, the funding constraints and in the impact to malaria control programs in Nigeria. So what are some of the funding constraints that we are facing?
Okay, so it is this is a very important question, because sometimes when you hear the statistics and you hear about how much of a body malaria is to Nigeria, you'd want to know what the contribution of the government is towards the elimination of this disease. So that makes the question very significant. Now, it will amaze you to know that fighting malaria is expensive. Sadly so. Fighting malaria is very expensive. It is estimated that it costs about $5 per Nigerian to prevent malaria. In the current exchange rate, we're looking at about 3,500 naira, right? For $5 for a Nigerian to eliminate malaria. Now, you will also know that, we have a national malaria control program in Nigeria, right? Which is responsible for implementing the national malaria strategic plan in Nigeria. You okay? Now, over 50% of the national malaria strategic plan is not funded in the Nigerian context, and that's a very serious problem. And one of the major barriers to implementing this particular component of the plan, is funding, right? Now, Just recently, I was looking at the Nigerian 2023 budget, and I realized that about 5.75% of the Nigerian budget, 2023 budget, is what is allocated to healthcare.
Healthcare.
Yes, about 5.75%. Now, I wonder what percentage of this money will be allocated to the malaria control, because the 5.75% of the entire budget is cutting across the entire healthcare system in Nigeria.
Yeah.
You know, so this is not just malaria. We're looking at tuberculosis intervention, cancer intervention, you know, and a whole lot. And then it is spread across both primary, secondary, and tertiary health institutions across the country. Okay, now 5.75% is just about 38% of the recommended 15% budgetary allocation for healthcare that was agreed by, in the Abuja Declaration of 2001 for all countries in Africa. So Nigeria posted the declaration, but Nigeria is performing less than expected. Now, according to the WHO, we're supposed to, WHO requirement, we're supposed to have one insecticide-treated net for 2 persons per household. However, if you and I conduct a simple research now, be it in the street of Lagos or in the street of Kano, Jos or anywhere, you will get to realize that we are nowhere close to meeting this target, because we still have a lot of families who don't even have a single insecticide net in their homes, right? Now, funding constraints cause an inadequate supply of vector control programs. So, indoor residual spraying programs, inadequate distribution of insecticide nets. Then, even when it comes to the issue of case management, there's a lack of adequate reagent for microscopy. We have rapid diagnostic tech kits who are not enough again in several primary health centers. Even medication, we begin to experience stock out of medications in primary health centers, in tertiary hospitals. I've been to hospitals a couple of times. Forget the fact that I'm also a medical practitioner, but then as a child, I remember, as a teenager, going to the hospital with my parents, and then unfortunately certain medications are not available. You're supposed to go and buy in the pharmacy. Good. So you go to the pharmacy, and then they don't have that particular prescription. They need to keep referring you over and over again, and this is a serious problem. Okay, so it's a very serious problem. Now, we must increase funding for malaria control, because owing to global inflation, owing to supply chain issues which has been caused by COVID-19 pandemic, owing to the war in Ukraine and a whole lot of other global issues, the cost of commodities are getting high by the day. And same budget that is used to address malaria problem in the year 2019 for a certain population cannot serve that population any longer in 2023. So there's a need to increase funding. There's a need to increase, budget, and the impact is just so gross. Nigerians living under $2 per day, and then I expected to fight malaria with $5 per person. What they are aiming is not even enough.
It's not enough. It's not enough at all.
This fight just malaria. They have food to eat, they have shelter, they have water, and a whole lot of other expenditures. Okay?
Okay, so
it's a serious issue.
How do we address this challenge, this particular funding challenge? How do we address it?
Yeah, so the way around it is just simple. Okay, the Nigerian government need to just become, they need to develop the political willpower. I'm glad we're beginning to have a change of government at state and national assembly levels, at Senate level, at State House of Assembly level, and even at the presidency. So this is an opportunity for the leaders who are coming into office to increase political will and make intentional commitments towards increasing the budgetary allocations for healthcare in Nigeria. And then they need to prioritize malaria control in Nigeria. All over the world, we are number 1 when it comes to malaria deaths. We are number 1 when it comes to malaria cases. Why are we not prioritizing the elimination and control of this disease here as a country? Considering the fact that we have a very large population, which is burdened by this disease, and then which is living under $2 per person and per day, is a very serious call for us to fix this issue. Earlier in August last year, His Excellency President Muhammadu Buhari had inaugurated what we refer to as the Nigerian End Malaria Council. The council is headed by Mr. Aliko Dangote, and then the council is also a public-private partnership which is formed to support the malaria control program in Nigeria. Now, what you should realize from this is the fact that across Africa, Nigeria happens to be, one of the countries that is getting its own End Malaria Council late. This is like a late arrangement. So, but they say it's better late than never. Okay. I was attending the Kigali Malaria Summit in Rwanda sometime in June last year, right there where we're raising we're raising about 18 billion US dollars for the global fund. Okay, and I had the privilege to interact with certain members of the End Malaria Council from Mozambique and Kenya and a couple of other countries. I'm able to see how much private-public partnership is able to help raise funding to help support malaria elimination in the country. So if the Nigerian government is making its commitment, and then through the Nigerian End Malaria Council, we're also able to generate enough of resources, both resources is going to help contribute towards addressing the funding challenge, right? I've had a conversation with the national coordinator of the National Malaria Control Program in Nigeria.
Okay.
We're together in Abuja in our office when I had a meeting with her, and then we also met in Kigali last year. And in the course of our interaction, one of the things she has always mentioned is the fact that when they make preparations for budgetary allocations for their programs, which is supposed to cut across the states of Nigeria, including the FCT, and they submit to the Ministry of Health, sometimes less than 20% of this budget is what is funded. Now, with that kind of dilapidated funding attitude, how do we expect to, reduce the burden of this disease on the Nigerian population? You see, there's no way out. So, government does need to take the center stage, and then companies, private individuals, well-to-do individuals need to support government through a public-private partnership and then support this funding.
Wow, that's a lot to take in. All right, let's just go straight to the last question, because we've talked about almost everything that I have listed in my list of questions. You've answered. We've talked about the challenges. I didn't even know about the resistance, the drug resistance going on, and it just gives an overview of what is happening. Like, a lot of people take malaria for granted. They take malaria to just be that everyday ailment that you can just go to the chemist or the pharmacy to treat. But based on what you said now, I've seen, and I'm sure a lot of people will see, that it's not something to take for granted. It's not something to just overlook and think that you might think you're treating malaria, but you're treating something else and you're causing more harm to yourself. I'm sure maybe next time we'll dive more deeply into the issue of self-medication. But let's just quickly talk about the lessons that can be learned from successful malaria control programs. Okay, let's just talk, and then let's talk about the successes of block malaria, because I know that you're the lead for the block malaria program. So let's talk about that. Let's dive into that. Can you share and highlight?
Thank you so much. Some years ago, I think about 3 years ago, I was invited to as a guest on a radio program here in Jos, Plateau State, Nigeria, and we're having conversations around malaria. It's actually a usual thing that on World Malaria Day, as malaria champions, a lot of media calls are brought up, and then you're supposed to go discuss, the impact of the disease, and then talk about the possibility of Nigeria eliminating the disease. The presenter asked me a question and said, "Do you think it is possible for Nigeria as a country to eliminate malaria?" And I said yes, and he was shocked. Just a year after that particular conversation, Algeria, which is an African country based in North Africa, was celebrated and acknowledged as malaria-free. Okay, now, yes, they were certified malaria-free by the WHO in 2019.
Wow.
I think 2018 or 2019, right? Now, this became an evidence that can be used to prove how, if countries make intensive commitments towards the fight against malaria, they could actually control the malaria spread and all that. You understand? Now, we still have countries in Africa that are near elimination right now. There are a couple of countries that are near elimination.
Wow.
What that means is that they're recording less than 50,000 malaria cases, all through the year, right? So this is in the African continent. So when we say that malaria elimination in Africa is not possible, then we bring out results to show you countries like Algeria, countries like a couple of other countries, South Africa, Botswana, that are making giant strides and are closing in the gap and are almost eliminating the disease. You understand? This is the situation. So I have taken time to study some of the policies that were adopted by the Algerian government to see what led them to the elimination, in 2018. Now, this is a very serious situation. Algeria as a country, made a 20 years commitment to the fight against malaria. What that means is that irrespective of change of government, they go to fight malaria and to increase funding for malaria was consistent for
Super.
20 years.
Wow.
So healthcare allocation was on the increase. Commitment to development of rural communities and all that was also on the increase. And then there was intensive surveillance, malaria surveillance across the borders, the various borders of Algeria. Healthcare system was well strengthened, okay, over 20 years before they were able to record this feat. Now, this is a case of a government seeing how important it is to eliminate a disease and then making the right commitment to it. Over time, they're able to record the success. Now, at Block Malaria Africa, for instance, what we do basically is to work with communities to help them build resilience against malaria.
Okay.
And this is a very serious issue. I remember I mentioned that Africa alone contributes about 93% of global malaria cases and about 90% of global malaria deaths. Now, because of this level of impact, there is a need for us to urgently address the issue of malaria prevalence in the continent, and even in Nigeria, which bears the highest burden in the African continent. Okay, that is in a bid to close this gap is why I founded Block Malaria Africa in 2019. Okay, so I see the fact that as a young person, irrespective of my age, irrespective of qualification, as at 2019, I have what it takes to contribute my own quota towards the elimination of malaria. Because the mistake that have always happened over the years is that young people are not carried along and are not given a center stage to make contribution towards a disease that affects them the most.
Okay.
More young people are more affected the most by malaria. However, young people are not given that chance to make contribution towards the fight against malaria. Now, in a bid to contribute towards elimination of malaria, I went ahead to found Block Malaria Africa initiative. This initiative helps to it focused on malaria prevention amongst most of the population. And then we employ behavioral change communication to promote positive health outcomes by studying the behavior, and providing effective messages and messaging materials that can address each community's need, educate people on what malaria is and how malaria can be prevented. I told you that one of the reasons why people self-medicate is because they don't even know the implication of self-medication.
Yes.
Now, that is where Block Malaria Africa steps in. Some people don't even know that keeping their environment and surroundings dirty, keeping their environment, keeping stagnant water around their environment can be a contributing factor to why they would have mosquitoes that will help later translate to malaria in their system. So they don't have this information. So one of the things we do is to go into communities that is most at risk and then educate them on how they can prevent malaria, educate them on how they can view why it is important for them to develop a good health-seeking behavior. What do I mean by that? Whenever they have symptoms, they need to run to the hospital to go and get checked before they go for medication. So we're helping communities realize the mistakes and then readjust their steps and all that. Now, in 2019, we carried out a project in a community here in Plateau State called the Genta Mongolo community. This community has about 30,000 people in the estimated population, and then we're able to provide sanitation, we're able to provide health talks, we're able to provide mosquito treated net. We're able to carry out medical outreach that provided medical health care, including malaria tests, and medication for over 1,083 individuals who are living in that community. Right? Now, beyond this intervention, we're able to also interact with the community leaders to find out what the challenge is, because we realize that this community, despite the dense population, lack access to primary health care. They needed to walk 2 kilometers before they can access the closest primary health center as a community. And on 2 different occasions, while we were carrying out community assessment in this community, I had met a situation where an individual was sick, and on the way conveying this person to the clinic, the person died on the road on the motorcycle. On 2 different occasions. One was a male, the other was a woman who just returned back from work. So, a community that lacks primary health center in the heart of the community, despite having over a 30,000 population, is a very serious problem.
Yes.
So, having this conversation, we went ahead to interact with the policy makers representing that community in the State House of Assembly. I went as far as in reaching out to the personal physician to the state governor, seeking for government intervention on behalf of this community. That is some of the work that we do. And as a result of these calls, we're able to have this community benefit from the massive distribution of insecticide treated net that was facilitated by the USA and the Plateau State government as of 2022. So this is some of the work that we do. Now, it will interest you to know that 99% of the members of the team at Block Malaria Africa are young people. It will also interest you to know that Operation Keep Jet Amongoro Clean, which is the project we carried out in 2019, was implemented by over 500 young people who were coming all the way from Benue, coming all the way from Gombe, from Bauchi State, and to Plateau State, all as volunteers to help support one community eliminate malaria or combat malaria. So this is how far we've gone. Okay, so this is what we're doing. This is what we keep doing, and several other communities across the region. So if young people are given the opportunity, okay, to come into the center stage and contribute towards the fight against malaria, so much can be done. In the words of the former Minister of Health of Botswana, who currently serves as the Executive Secretary of the African Health Malaria Alliance, Ms. Joy Fumafi, she says, young people are the most visionary asset we have in the fight against malaria. Youth are creating solutions to engage community and advocate for political will to end malaria. That is the reason why we have the ALMA Youth Advisory Council, where I serve as the West African lead in the current council, right? So it is really important. We've done so much already as a country, and then there's a need for us to continue with this effort. And Nigeria needs to leverage the 67% young people population in the country in order to help drive this message of zero malaria start with me, so that we can be able to achieve the malaria-free community. It's not going to be easy, and it's not going to happen in 1 year. But we need to be steady in our commitment, and we need to keep increasing our commitment as the year goes by, because the mosquitoes themselves are not waiting for us. They are changing and also developing newer strategies to help combat the medicines and the insecticides that we have fighting them with.
Wow. It was, in fact, I think I'm speechless. It's been a very beautiful conversation. I think I'm speechless because this hits very, very close to home. I see how I am actually part of the statistics, and I also see the part that I can play, in fighting malaria. For instance, number one is to stop self-medication. But yes, it's a lot to take in. I think I'm going to still redigest and listen to this again, and I hope to play my part, and of course create awareness anyhow I can. And all right, thank you so much. It's been a lovely conversation with you, Mr. Odinaka, and I look forward to Nigeria reaching the stage where Algeria is. It shows that it's possible. It's possible for Nigeria to eradicate malaria, and it's also very inspiring what you're doing with block malaria, and you've shed a lot of light into what young people can do, in fighting malaria, and I think young people are also part of the people that self-medicate a lot when it comes to malaria, right? They self-medicate a lot, and I'm glad to see that you're changing that narrative. Instead of people self-medicating, they have the young people now telling people the right way to treat malaria, and it's very inspiring. Thank you so much for what you do, and I look forward to learning more and getting more. Knowing about more achievements that you're making in the fight against malaria.
Now that was a very, very interesting conversation. The highlight of the conversation for me was learning about countries that are able to successfully eradicate malaria in their countries. Now in the end, the struggle against malaria in Nigeria is a battle for a unified narrative, one that recognizes the disease for the threat it truly is and empowers individuals to take meaningful action. Now the fight against malaria is more than just medical endeavors or intervention. It is a call to write the story of the nation's health, transforming indifferences into determination and uncertainty into hope. Now this brings us to the end of today's conversation. If you enjoyed it, please remember to give it a thumbs up. Remember to also subscribe, and you can also share, and also follow me on social media at Amazing Tife. And now HealthAssay also has its own social media. It's HealthAssay on all social media platforms. So until I come your way again next time, cheers and be safe.